I have always been interested in issues of social justice. Growing up, my mom would call it sensitive, but now I know it as being in tune to people's needs. All throughout growing up, I was concerned with issues of identity, with issues of history, with people's well-being. And it wasn't until I actually came to college when I approached someone asking for help. How do I bring together all these different interests? How do I choose between the Asian American movement and the LGBTQ movement? And that person asked me, why do you have to choose? Why can't you just do both? That thought had never crossed my mind. I used to think of my identities and my communities as being far away from each other, as never coming together except for in myself. So when he said that, it made me reconsider what I thought was possible. APINC, API Equality Northern California, we're an organization that works for and by the LGBTQ Asian and Pacific Islander community here in the Bay Area to build our power, amplify our voices, and create transformative, better futures for all of us. HIV and AIDS isn't a specific emphasis of API Equality in Northern California, but our community as a community of LGBTQ people has always been and will continue to be impacted by HIV, AIDS, and other health-related issues and disparities. Health isn't a specific focus, but it's incorporated in all that we do and how we approach people and in how we think about history. In the past 5 years, there's been an increase. Folks in the API community have an increased awareness that LGBTQ people exist in our families and in our communities and in our organizations. And that's been a really big shift that APINC has worked on a lot. Working so that the API community can't distance themselves from the LGBTQ members in our own families. And what we have to do now is ensure that that recognition is genuine, authentic, and long-lasting. LGBTQ issues have become widely known in the mainstream. The violence against our people has become widely known. But like trends in society, we can't just let this be one trend that people think about for a few years and then leave to the side when another trend issue pops up. Unfortunately, the term API, I think, has just been thought of as a way to lump people together who might vaguely share experiences, but who come from a host of different realities. It's a term for people who don't know us to define us. So I think for people who have been placed in that category, it's up to us to determine, are we gonna let that outside gaze define us, or are we gonna be intentional about what we do with it? In my own mind, API, Asian Pacific Islander, is a solidarity term. We must think, what is the strategic purpose of us identifying as API? How do we advocate for each other's issues in different spaces? So for instance, as a Filipino American person, how do I really stay attuned to the struggles of Pacific Islanders who are still fighting for the rights of their indigenous land? How do I show up for my Muslim and South Asian siblings who face Islamophobia and xenophobia, especially now in the rise of Trump and post 9/11? How do I think critically about solidarity in my own community rather than just letting this be a term that lumps people together and erases their experiences? It's just assumed in the mainstream of the United States that if people are sick, they're gonna wanna go get health care. Or if people are ill, they're gonna tell people about it so they can get better. But that's not how we always deal with things in the API community. And I think that those issues around how much we talk about it, how publicly, how we ask for help, are sometimes specifically cultural. When my own community members are hesitant to access health care because they've never grown up with healthcare in a Western context, it's going to inhibit their ability to understand what they need to get better. I think for HIV and AIDS, a lot of it comes down to family and a lot of it comes down to story. What people care about a lot is the oral history between generations. So how can we actually tell the stories of our community members that have been impacted? And how do we pick out the things in those narratives that can actually transform our access to health? So when we hear a story from an older person who has HIV or AIDS, how do we listen to the ways that that's connected to their culture, that's connected to their family? For young folks in the API LGBTQ community, I don't see a lot of people talking about HIV and AIDS. I think that there's a lot of reasons why that happens. I mean, the unfortunate reality is that a whole generation of people passed away without being able to tell their stories and carry their legacy forward. And I think within the younger generation, there's just a lot of historical amnesia. People don't know. People don't know the degree to which the epidemic hurt so many people. People don't understand the ways that people had to organize to live, not because they had some like grand idea of social justice. They were just doing what they needed to do to survive. And I don't think that urgency is understood by a lot of younger folks. Maybe they're talking about PrEP, maybe they're talking about prevention, maybe they're talking about getting tested, but they're talking about it as in isolated individual experiences, but not through the historical lens that has led us here. I think about the older folks in our community all the time. As someone who has grown up with actually very little connection to my blood family, when I say chosen family, there's no joke behind that. That's just my family. The only reason why I'm literally alive today is because of the older community members that have fed me, that have housed me, that have brought me in, and that have nurtured me to be the organizer that I am. And so I believe that all of the folks in our older generation just need to know that we see them and that we appreciate them and that we know the work that they've done and we crave knowing more. Even if we don't use the same words to talk about our experiences or have the same lingo or ways of being, or we have too many check-in questions or whatever else, at the end of the day, like, we are still of the same lineage. And we want to hold our elders for all that they are and gratefulness for all that they've done, because we wouldn't be here without them.